All right. Hi, I'm Dr. Vickers. I'm a triple board certified dermatologist and Mohs surgeon, and today, as briefly as I can, I'm going to try and tell you what Mohs surgery is all about. So Mohs surgery, which is the last name, by the way, named after Dr. Frederick Mohs, is known by a couple other names, including micrographic dermatologic surgery and complete circumferential, peripheral, and deep margin assessment. That one is less catchy. Mohs surgery is the gold standard for removing skin cancer from sensitive areas of the body, like the face, and has both the highest cure rate of any other method and also leaves as much normal skin tissue behind as possible. The key part of Mohs surgery is that the Mohs surgeon is both the doctor to remove the skin cancer and to check in the lab to make sure that all the skin cancer is gone. If this is skin cancer, and you use your imagination a little bit, tricky part about skin cancer is even though that this model makes it seem really obvious where the skin cancer is and isn't, because it's bright red, and that it can spread and have growths underneath the skin that might not be obvious and you can't really see from the top. So it's hard to tell just by looking from the outside exactly how far this cancer can spread. So how do you make sure you get it all out? That's kind of the key. One method that we use in lower risk areas is called wide local excision. You simply start off with where it looks like the tumor ends, and then you take an extra margin of skin around that, and you cut the whole thing out to make sure that you catch these little growths underneath the skin. And typically once this is removed, this is sent off to a lab, and then a different doctor takes a look at what's removed and ensures that this doesn't go to the edge and that you've got everything out. And that works great for many situations, but if this is sitting next to a very important structure, like say your eye or your nose or lips, very important to leave as much of that normal skin tissue behind as we can. So Mohs, the approach is a little different. We start off with a much smaller margin around what looks like skin cancer. We then process it immediately in the lab, and we check all the sides and underneath to make sure that we get all the skin cancer out. And we maintain the orientation in 3D and map it back to you. So if, like in this model, you see a little bit of skin cancer at the edge, you know exactly where that represents on you, the patient. So you only have to go back to where that is and remove the tiny amount of skin cancer left, and you can leave all this normal skin tissue behind, which in some areas can make a really big difference. So, frequently asked questions. The first one is probably, how much does it hurt? And that would be my first question. The only painful part of the procedure should be the very beginning, when we have to numb you up. And we use lidocaine, which is just like Novocaine at the dentist, probably the same thing you had for the skin biopsy. We inject the numbing medication with a little needle, and that first poke is always the worst. It's not fun, but it is over very quickly, and the numbing medication itself works very, very well. So throughout the procedure, you really shouldn't feel any pain. It's an odd sensation to have your skin kind of tugged in a way you're not used to, and you can even hear some odd unnerving sounds as it happens, but nothing is painful throughout the procedure. When you're all done and you go home, usually about 2-3 hours later, the numbing wears off, and people are usually very surprised. It's not very painful. It's more of a soreness, and 99.99% of patients can completely manage it with Tylenol and Advil or a combination of both. The next most common question is, okay, you removed the skin cancer. Now I've got this big hole. How are you going to fix it, and what is the scar going to look like? Unfortunately, because we don't know exactly how big the tumor is going to end up being, before we get started, it's really hard to know with any kind of certainty how big the hole is going to be. And so it's hard to tell you for sure what kind of repair we're going to do to fix it. But I can tell you some general guidelines, and I would sum them up as simple is better. And most of my patients agree with that. What I mean by that is if the tumor ends up being small, the repair is going to be small, and we're going to keep the scar as small as possible because of that. There's many, many different methods that we'll certainly discuss with you. They range from the simplest, which is probably either just letting it heal in on its own. That's a great option in some cases, to simply pulling the sides together with some sutures. But there's other situations where it's either on a point or pulling it together is going to lift up on the nose or the eyelid or something like that in an obvious way, where it's a better option to cut a little bit further and move skin over, and it ends up looking better. But that's kind of a topic for another video. But I think the takeaway is that we certainly want to keep things as small as possible and make it look as much as we can like we were never there. But it is impossible to remove skin cancer through any method and not leave some kind of skin change or scar behind. The goal is always to make that scar as easily disguisable as possible and look as much like normal skin as we can. So that's Mohs surgery in a nutshell.